Hi. I'm robo-Suzie and today I'll talk to you about how to deal with heart valve disease. Also don't forget to subscribe for more tips in the future. But back to our topic. Heart valve disease occurs when there is an existing problem with one of your heart valves. It is a necessity for the public to be aware of the consequences of this disease. In the worst case scenario, this condition may cause the untimely death of a person. Therefore, an early detection and a prompt treatment may avert further consequences taking place. The functions, causes, symptoms, diagnoses, and even the treatments are important information concerning heart valve diseases. The heart consists of a few structures that are put together to pump blood to the entire body. There are several parts within the three layers of outer structures of the heart. The upper and the lower chambers are commonly known as the atria and ventricles. They are the major parts of the heart. The lateral classifications of the heart, the right and the left portions, are not the only structures that comprise the heart. In between these chambers there are heart valves. The valves are also seen prior to the pulmonary vein and subsequent to the pulmonary artery before reaching the left atrium. The mitral valve can be found in between the left atrium and the left ventricle. It has two leaflets that actually flail as the valves open and close. At the other side, the tricuspid valve is found between the right atrium and the right ventricle, and it has three leaflets. The basis for the names of the valves comes from their structure. The function of these heart valves is to provide a one-way stream of blood inside the heart. The one-way stream of blood is very important to maintain the normal function of the heart. The valve provides the blood a passageway before leaving each chamber by opening its leaflets. Inversely, it prevents the blood from flowing backwards by closing its flaps subsequent to the flow of blood through it. The relaxation and the contraction of the heart tissue triggers the open and close mechanism of the valves which control the flow of blood. When the purpose of the heart valves diminishes, due to bacteria or other conditions, the functions of the heart are also disrupted. The malfunctions are classified into two classifications, regurgitation and stenosis. Regurgitation is the flow of blood with a backward direction, and stenosis is the narrowing of the heart valves. As the heart valve disease occurs, many manifestations can take place. The actual condition of the disease doesn't necessarily reflect on the manifestations. It can occur abruptly depending on the duration of the disease progression. The development of this condition may vary from one person to another. Some patients may have a longer disease process. The symptoms may mimic other conditions such as heart failure. It is always easier to prevent a disease than to cure a disease. This is especially true for this disease because the treatment comprises an expensive multifaceted approach that entails administration of medications and surgical procedures. Preventing the incidence of heart valve disease is the immediate treatment for a sore throat by using potent antibiotics. This intervention is performed to avert the occurrence of rheumatic fever that eventually can lead to valvular heart diseases. Maintaining a healthy heart diet will also prevent the prevalence of this disease. The early recognition of the symptoms is a very good secondary preventive measure to avoid further complications. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.